Okay, so very good afternoon, all of you. This is Dr. Ruchi Shirudkar, founder director Pediatreat. I'm so sorry for coming live after so many days. Today, that drug that we are going to discuss is staphysagria. I told you the drug beforehand because so that you can be ready with all your questions and what all difficulties you have to understand this drug, right? Yeah, so we'll be doing staphysagria today. I'm going to share some few cases how you are going to pick up these remedies in your clinic, right? What I have observed is we know a lot of theory. If I ask you about staphysagria, probably you can be able to tell me so many things. But when it comes to patient, when we see patients in the clinic, then we have the difficulty of, difference between natriuretic and staphys and how to pick up, because we always don't get the ideal picture of any remedy. We don't get ideal staphysagria as written in our textbooks. So I'll share first case with you, which I have recently shared in a group. So this was a lady. She was an editor of 2 Marathi magazines, and she came to me for knee pain and shoulder pain and a lot of acidity. And when I asked her about her complaints, she showed me that she has osteopenia and she has heel pain. It is so difficult to walk, and she has shown to 2 orthopedic physicians and 2 physiotherapists, but all in vain. She had no result with that. And then she had heard a lot about homeopathy, and so she thought of showing me. This case is a very old case, almost 10 years back. I'm sharing this case because it's very, very simple to pick it up. So I asked her, okay, anything else? And then she herself started that all my problems, is because of my child, because of this boy that I have. I have only one child, the one boy who had 94% in 10th standard and 12th standard. He flunked, he's failed in 12th standard. And he's smoking, he's drinking, he's into drugs, and he just doesn't listen. And I feel so bad, how to explain him. We are not very rich, but we are from a reputed family. All in our family, all of us are very, very highly educated. My husband has struggled a lot. He's an engineer in a government, and he has a government job. We are all very, all my cousins and relatives are all are very reputed. We are doing good in our jobs, and so it feels so bad, seeing him going this way. There are so many times that I have followed him just to see where he's going. And can you imagine that in 12th standard he had a practical, but because it was a Valentine Day on that day, so he missed his practical and went after that girl. That girl's parents were also so upset and they had beaten him. But when they came to, मतलब जो girl के parents थे, जब वो हमारे घर आए, when they came to our house, they realized that such a good family we are, and they also felt helpless. And बच्चे सुनते नहीं हैं. What we can really do if kids don't listen? And I feel all my problems have started because of this only. And she kept on saying all this. So when I discuss this case, I want you all to comment. I hope you are able to comment. Write something, hello, hi, something, so that I know that you can comment and put your views also while we are discussing the case. So when I had shared this case yesterday, so a lot of people came up with vanilla. Why? Because delusion, do nothing she could do, or cares full of children about, or anxiety children about. But the point is, every helpless mother will not be vanilla. Here in this case, her main focus was that we are a reputed family, we are a good to do family, all are highly educated. I tell my child, see, behave like your cousins behave. You only judge, you only see how your cousins behave and decide what kind of behavior is expected from you. So here, obviously as a mother, you worry about your child, but the main focus of the lady was, and she had a lot of anger towards her child. And I said, how do you react? So she said, I don't say anything. Kai karna na, what we can say, we are not like any altu faltu family who will shout at the top of their voice. So we are a reputed family. I really don't shout or beat him. He should understand. So there was a lot of anger suppressed, anger, misdeeds of others, from indignation. That child used to create a fuss in the house, and when the relatives are there at home, he used to abuse or shout or fight. So a lot of indignation, mortification. She said, I feel very embarrassed. I feel ashamed to go in parties and family function because of this boy. So there was a lot of ailments from shame. I didn't took anxiety children about in this case, because more than worry about the child, she was more worried about the repetition and position in the society. And so yes, the remedy given was staphysagria, and she had amazed. She came back and she told me, "Oh God, what remedy you gave me! By the time I reached home, I felt better, and more than that knee pain, heel pain." She said that next day only there was a fight in the house, and the child was creating a ruckus, and I was able to handle. So situations don't change, but our ability to deal with the situation becomes better. And with no repetition in 3 months, she was fine. So yes, this was first case. So the learning from this case that you should carry is, we don't prescribe on the situations, we prescribe on the patient's reaction in that given situation. So ये जो बच्चा बिगड़ गया है, या बच्चा सुन नहीं रहा है, ड्रिंक ले रहा है, स्मोक ले रहा है, यहाँ पे जो मेन पेशेंट का रिएक्शन है is about the position in the society, about her repetition, indignation, anger. So that is important. If you go and prescribe on the situations like anxiety children about, there's a lot of care and worry about the child, then you will fall in a trap. You have to, I have repeated it so many times, but I would again say that just think for a moment before forming a rubric. I have seen people, forming it so fast, this, and it doesn't work, because you're converting the sentences into rubrics. We are not a converting machine. Think situation, patient's reaction, and what kind of a person in this given situation, if reacts this way, what kind of a person she is, right? Is she having a overwhelming anxiety about the child, or she worried about the position, or she has righteous anger, or she's feeling embarrassed and shame? So what feeling that situation is generating in me is the remedy, and not that situation, because some anxiety would want to be there for the child, right? For example, I'll give you one more example. A lot of students ask me कि skin का case है, eczema है, या psoriasis है, and the patient is saying कि और लगता है, यहाँ चेहरे पे है, या brows पे psoriasis है, या वो dandruff गिरता रहता है, अच्छा नहीं लगता. So don't you feel her 99.99% of people having skin diseases will have this expression? Don't you feel? Yes. So that ailments from embarrassment doesn't have a lot of significance in that case. If that case, a person coming with a lot of acne, and I asked her recently कि क्या लगता है? कुछ नहीं लगता है, I'm okay, I don't feel anything, I don't bother about it. So yeah, लगता है, but I'm not doing anything, So that reaction in that skin disease or in that acne or whatever is important. And it should not be, though we prescribe on the mental state in that disease, but that you have to always evaluate in the sense, okay, what is so important? So that embarrassment in a skin disease is not very important, right? So in the same way, anxiety about children in such a case where it is bound to be there. So what is peculiar to that patient, right? So that is our totality. That would be our core of the patient, because that is what she's feeling in that stressful situation. Okay, so second case, and I'll share 2-3 cases, and then we'll go to the journey of staphysagria. I'm not able to see any comments. Are you all not able to comment? I don't know. Yeah, so I'll finish, and probably we can discuss on our Telegram group about this remedy if you're not able to comment here. Okay, so yes, this was first case, and the second case was there was this boy in 10th standard. He came to me for he was treated by me earlier when he was a child, say when he was 4, 5, 6 years old. But this time, after a long gap of say 8, 10 years, he had come to me and he was asthmatic and he was breathing difficulty. So I asked him, "Ki kya hua? How?" He said, mother was with him and mother said, "Batao." So I asked him कि क्या हुआ है. He said, I go for the cricket and I'm very fond of playing cricket and I play really well. Especially batting, I do really well. And there is a new coach who has come up and he has some problem with me. He just doesn't give me to bat and he's making me take rounds of the ground. और वो मुझे बोल रहे हैं कि तुम bowling करो या fielding करो, पर वो मुझे batting ही नहीं दे रहे. And I am, first 2 days I said okay, then third day, then fourth day, and now I'm feeling so bad. What is my fault? He should tell me. Now I'm feeling so angry upon that teacher, on that coach. So I asked him, "Ki, what you did?" So I did nothing. I said, "Why? बड़े हैं ना, coach है, teacher हैं. How can I say anything?" But I'm really angry with that coach. बिना बात के मेरे को वो bowling करा रहे हैं या fielding करा रहे हैं. So I had prescribed staphysagria in that case, and he responded beautifully. And he, without any nebulizer or inhalers, he was cured. So why staphys? Because there was a lot of ailments from suppressed anger, sensitive moral impressions too. He didn't wanted to indignation. उसको लग रहा था गलत कर रहे हैं teacher मुझे, and yeah. So this was the totality, and we prescribed staphysagria, and he responded very well. So we know this facet of staphysagria, that there is a lot of indignation, suppressed anger, vexation, mortification, indignation, silent grief with where people are not able to respond and they suffer. So this facet, I'm sure you all know about it, but sometimes we fail to pick it in the clinic. I'll share a recent case where this lady had gone in a marriage, in a function, and she has 5 girls, she has 5 daughters and there's no boy or child. So she went into a marriage and there everybody had a good time, and then when she came back she started with fever, and it was 5, 6 days. They had given antibiotics and it was not responding. So I asked her, is there anything bothering you? So first she said no, nothing. So these are mild, docile, yielding, pulsatilla kind of appearance, too polite. So sometimes you don't get that anger. So I asked her, is there anything bothering? So it's nothing is bothering me. So I said, kuch hua kya 5, 6, 7 days mein? Said, oh yes, I had gone for a marriage, and वहाँ पे there were 2-3 ladies who were commenting, कि देखो बिचारी को, she has only girls, she doesn't have a boy child, and they were commenting. So I said, what you did? So she said, I felt really bad and little angry about that. कि what, I am happy, my kids are happy. And she was a lady from a little low socio-economic status, Sometimes we don't feel that there can be indignation in them, or they can be... so very casually she told me, मला काई problem... मराठी में बोला उसने कि मला काई प्रॉब्लम नहीं, मेरे को कोई तकलीफ नहीं है, आई एम हैप्पी विद माई चिल्ड्रन हु आर देयर टू कमेंट. पर मैं कुछ बोली नहीं. So there was not a lot of overt anger. There was not a lot of anger suppressed. And she came home and she started with fever. They thought that marriage में कुछ खाया होगा, या पानी बदलने से या हवा बदलने से उसको fever हुआ है. So in this case, there was not overt anger or indignation या righteous की fight या anarchist. Staphys is also anarchist. So ऐसा कुछ नहीं था. But still, in a subtle way, she felt a little bit of disturbed or angry or hurt or emotionally not like that situation. She didn't voice it out. She said there's no point voicing it out. तो ये जो लो सोशो इकोनॉमिक है ना, ये बहुत उससे नहीं बोलेंगे, बट यू हैव टू पिक इट अप कि शी डिडंट लाइक इट, शी वाज नॉट एबल टू टॉक अबाउट इट, and while coming home she ended up with physical illness. So I had given staphysagria in that case also, and it responded very well. And the last case, and then we'll go to the journey of staphysagria. So the last case I had shared when I did a webinar on psychiatric cases, and then I had shared. So in this last 2 years of COVID, I had got a lot of pediatric psychiatric patients. I've been practicing since 17, 18 years, but in the 16 years, I must have hardly seen 2-3 psychiatric children with psychiatric illnesses. But recently the cases have increased a lot, maybe the parents are too paranoid or doesn't want to send the children out, or there's a lot of always a fear in the house, a lot of situation, or they are glued to the internet. So many reasons, to increase psychiatric cases in children. So this case I had taken online. He was a distant relative of mine. So told me that the child is keeping quiet, wants to be alone, and doesn't want to be talk, and he has developed little fear and anxiety, and so he's not his normal self. He doesn't want to meet his friends, and because I was a distant relative, the child was not ready to talk to me. So after a lot of convince, their parents, I also said that I would behave like a doctor and you can talk to me. So child was ready to talk, and when I took the history, the child said that while he was studying and he was just googling something, a lot of availability of net, so he ended up seeing some porn videos, and then he ended up in a habit of masturbation, and he didn't realize what he's doing, and he was in 8th 9th standard, and after that there was a lot of guilt and remorse, and he was feeling very bad about it and very guilty about it, and he didn't want to talk to anybody. A lot of fear, if mama comes to know, what will happen. A lot of anxiety. Am I doing right? Is it the wrong thing I'm doing? Why I'm getting into all this? And so that was the state altogether, and a lot of fear and anxiety and restlessness, fear of small things. He was not able to study, he just wanted to be alone, not wanted to talk to, please leave me alone, I'm feeling very anxious. And deep within there was a lot of guilt regarding this. So in that case, I had given staphys. A lot of people said that guilt would be cyclamen and remedies for, but I had given staphysagria. So I have written some rubrics where company, aversion to, desire for solitude in order to indulge in sexual fantasies, dwell sexual matters on, indifference, masturbation after, reproaching oneself, this is very important, reproaching oneself, sexual fantasies from indulging to. So he was blaming himself, sensitive to moral impressions, anxiety, masturbation from, anxiety, sexual desire from suppressed, dementia, masturbation from. So I had used in few cases of young children who had gone into masturbation, and after that they feel a lot of guilt and anxiety and fear and restlessness and uneasiness. This is the remedy. You should think about this remedy primarily in such cases. And with this COVID, there are so many children, unconsciously or out of curiosity, they have seen something and then they have got into it and later into the guilt. It should be a primary remedy or focus, right? Okay. I just don't know why I'm not able to see the comments. There is some problem with my this group. Last time also I was not able to see the comment. So so I have shared 3-4 cases of staphysagria, and so you can pick these from various angles, not always suppressed anger, not always that, boiling, simmering anger. I told you about a child. There was one more child where, the child was very mild, docile, yielding. I have seen staphysagria people using only for adults when there is a lot of suppressed anger and the adult is not able to argue. But I have used in children who are mild and parents are strict and dominating. तो बच्चे कभी रिएक्ट करते हैं, but the child has fear of reprimands and reproach. तो but उनके अंदर दबा हुआ anger रहता है. Mother would say कि he is angry. I know that he keeps that anger within, but he doesn't say or he doesn't voice it out a lot because डांटेंगे हम लोग. We don't like children reacting this way. So yes, these are small tips of picking staphysagria. Staphysagria is a big remedy. It is impossible to cover it in one session, but we'll try to see a little journey of staphysagria, a little psychodynamics, how this we get a staphysagria adult. And then because we are not able to see the questions here, we'll discuss the questions in the Telegram group that we have. Okay. So staphysagrias are basically mild, gentle, yielding, polite to polite, very nice children. But she's an anarchist. She's injustice cannot support. There is a sense of right and wrong. There's a sense impressionable, sensitive to moral impressions. So there are things which they don't like. They don't like being treated the way they don't deserve, right? So in children, you will see a lot of rubrics of anger, abusive children, destructive behavior problems children in, anger children in. So they react, but that reaction is not very welcome. So the parents will scold them or rebuke them or reproach them or give them a punishment or criticize them for showing that reaction. And gradually what the child will, because the child is a very sensitive to a social position, they wanted to maintain the good girl image, so they stop reacting. But if you see, the staphysagria doesn't cover emotions predominated by intellect. तो ऐसा नहीं है कि intellectually वो situation resolve हो जाती है, but they suppress it. They say it's better not to speak up because mama डांटेगी. But that feeling will always remain. जैसे मैंने आपको वो lady का case बताया कि ऐसा नहीं था कि उसको बहुत गुस्सा आ गया था उस पार्टी में जाके कि इन्होंने मेरे बच्चों के बारे में क्यों बोल दिया या ये इन्होंने क्यों बोला मेरे को 5 बेटी है, बट उसको अच्छा नहीं लगा एंड वो कुछ बोल नहीं पाई, राइट? सो हमेशा आपको एकदम ड्रामेटिक पिक्चर नहीं मिलेगी, इसलिए आपको वो पिकअप करना आना चाहिए अपने क्लिनिक में. एंड देन बिकॉज ऑफ दैट सप्रेस्ड इमोशन एंड दैट फीलिंग शी वाज सफरिंग, राइट? ओके. सो इफ यू सी चिल्ड्रन तो बहुत सारे एंगर के हैं, बट अगर आप बड़ों में देखें तो एंगर नो एंगर और आर्ग्यूइंग नॉट आर्ग्यूइंग, anger never angry, arguing not arguing, ऐसे rubrics है. But you will see that mental symptoms with physical symptoms like voice complaints of, anger, throat constriction of. Recently in a group there was a case discussed where एक फादर इन लॉ थे, उसकी डॉटर इन लॉ ने उनको कुछ तो चाय या कुछ तो लाके दिया एंड इट वाज नॉट वेरी रिस्पेक्टफुल वे ऑफ द वे ही एक्सपेक्टेड, और उन्होंने वो कप फेंक दिया क्योंकि उनको लगा ये गलत है इस तरीके से. वो सिचुएशन क्या थी मुझे अभी याद नहीं है, बट इट वाज अ वेरी वंडरफुल केस ऑफ सम डॉक्टर एंड वो फेंक दिया एंड उसके आधे घंटे बाद ही एंडेड अप विद, बहुत गुस्सा आया उनको और ही एंडेड अप विद स्ट्रोक. So if you see in repertory anger paralysis with its single staphysagria, that was the time I learned कि हम लोग arguing या anger staphys में हम drugs like colocynth या जो बहुत गुस्से वाली drugs हैं वो सोचते हैं, but anger paralysis with, write down, it's anger one-sided paralysis with is staphysagria. क्योंकि स्टैफिस में ऐसा नहीं है कि गुस्सा नहीं है, गुस्सा तो बहुत है, बस उसके एक्सप्रेशन अलग है, राइट? तो ऐसा नहीं है कि गुस्सा नहीं करती है स्टैफिस. स्टैफिस में सारे रूब्रिक्स हैं ऑफ एंगर इफ यू रीड, राइट? सो दिस इज वन मोर केस दैट आई वांटेड टू शेयर, एंड एंगर पैरालिसिस विद, एंड देयर आर सम अदर सिंगल रूब्रिक्स. हाइपोकॉन्ड्रियासिस इंसल्ट्स फ्रॉम, अगर उसको इंसल्ट फील होता है तो द रिएक्शन इज ऑफ हाइपोकॉन्ड्रियासिस. इसमें भी सिंगल staphysagria है, hypochondriasis insults from, right? So they develop this position or dignity in the society, or there's a little bit of haughtiness like Platina in staphysagria about their image. I am of some standard, I will not shout in public, or I will not behave a particular way in public. But so if you see, there is a lot of rubrics of delusion tall she is, delusion great or large he himself seems. There are some, because she thinks highly about herself, because of that dignity she's very worried about log kya kahenge, social position concerned about, ऐसे rubric about opinion of others you will find in staphysagria. So yes, so they would appear very mild, but they have a lot of suppressed anger. Or you can pick up staphysagria in children where they're mild, yielding, but मन में गुस्सा रहता है, बाहर नहीं बोलता है. And in puberty, if they have a habit of masturbation and guilt and remorse after that, and feeling of anxiety and restlessness after that, or if not guilt also, I told you कि company aversion too, wants to be alone to indulge in sexual fantasies is also staphysagria. Otherwise हम maximum lachesis, medorinum ऐसे drugs सोचते हैं. Two important points that I want to make over here is, first of all, don't make fixed images, you know, कि anger से paralysis हुआ तो staphys तो हो ही नहीं सकती, you know. We'll think about remedies. Always repertorize. We walk two ways, repertory and our materia medica knowledge. कई बार आप एक सिंगल रूब्रिक से एक केस सॉल्व करते हो, एंड अभी रिसेंटली एक राजस्थान की कोई डॉक्टर थी, उनको केस था, एंड शी टोल्ड मी सो मच एंड शी वाज वेरी माइल्ड, एंड वो आई ऑलमोस्ट थॉट ऑफ पल्सैटिला, बट देयर वाज लॉट ऑफ sadness from insults, and I had given her cocculus, you know. If you would have if I present that, if she allows me to present, I'll present that case someday. पूरे केस में आपको कहीं भी ओवर केयर या वो नहीं मिलेगा जो यूजुअल हमें पिक्चर ऑफ कॉक्युलस बताया है, बट बिकॉज ऑफ द फैमिली एनवायरनमेंट शी वाज फीलिंग इंसल्टेड, एंड because of that insulted feeling she was feeling sad about it कि यार, you know, ये तो मेरी insult हो गई, ये लोग अच्छा नहीं, and from that we had gone to cocculus. So every remedy has lots of facets. Please don't make fixed images. Make an image. I'm not saying don't make an image. It helps you in prescribing, but don't be too glued to those images कि इसके beyond तो हो ही नहीं सकती, right? So that is the learning to be carried home. First point. And second point is always read repertory. If you ask me books, I will say that read repertory more, because repertory give you an unprejudiced image of a remedy, you know, and कि ये भी हो सकता है या ये भी हो सकता है. Right. So I'll share few more rubrics and then we'll wind up. Ailments from writing life. अभी किस वजह से स्टैफिस सफर करता है? डोमिनेशन, सेंसिटिव टू डोमिनेशन, हार्श अपब्रिंगिंग, रेप्रिमैंड्स, रिप्रोच, ये सब एलिमेंट्स हैं. रूडनेस ऑफ अदर, राइटिंग लेफ्ट हैंड, सप्रेशन ऑफ. क्या होता है, अगर जो लेफ्ट हैंडेड बच्चा है उसका एक नेचुरल इंक्लिनेशन है लेफ्ट से, तो जब आप बोले इससे मत कर, इससे मत कर, तो उसके नॉर्मल डिजायर्स को या नॉर्मल जो उसकी टेंडेंसी है उसको आप सप्रेस कर रहे हो, राइट? ओके, सो आई हैव एक्सप्लेन दैट कि उनके बहुत एंगर होता है बट इट इज़ नॉट वेलकम्ड, तो वो सप्रेस कर लेते हैं बच्चों में. आई टोल्ड यू कि उनके अंदर बहुत सारे ऐसे रूब्रिक्स हैं, जैसे बॉडी ग्रेटनेस ऑफ, ह्यूमिलिटी एंड लोनेस ऑफ अदर्स वाइल ही इज ग्रेट, डिल्यूजन लार्ज ही हिमसेल्फ टू, स्मॉल थिंग्स अपीयर स्मॉल, टॉल ही इज, ईगोटिज्म है स्टैफिस में, सेल्फ स्टीम, स्पीकिंग ऑलवेज अबाउट देमसेल्व्स इन कंपनी. ठीक है, तो उनको डर क्या रहता है? फियर ऑफ लूजिंग सेल्फ कंट्रोल. दे सप्रेस देयर डिजायर्स, इमोशन सप्रेस्ड, ग्रीव साइलेंट, इंडिग्नेशन विद. Okay, so they have become reserved. So because the past is not resolved, there will be lot of rubrics related to past. Dwells past disagreeable occurrences on, dwells griefs from past offenses, grieves offenses from lost past, offended easily from past. ऐसे आपको बहुत सारे rubrics मिलेंगे. Okay, and social position that I explained. Okay. So what you have to do is go home. First of all, आप FN-F4 सर्च विंडो में, FN-F5 सर्च विंडो में जहाँ आप रेमेडी स्टडी करते हैं, आप स्टैफिसैग्रिया डालेंगे एंड सारे सिंगल रूब्रिक्स ऑफ स्टैफिसैग्रिया. एंगर पुशेस द टेबल अवे. क्या कर रहा है? थ्रोइंग थिंग्स ऑफेंडेड हु हैज, मतलब किसी ने मुझे ऑफेंड किया, मैंने सामान फेंक दिया उसके ऊपर, तो ये स्टैफिस करता है. ओवर्टली नहीं चिल्लाएगा, पर यू नो हल्का सा धक्का दे देना. जरूर नहीं है टेबल ही पुश करे. अपनी बुक मैंने ऐसे पुश, मुझे गुस्सा आया और बिकॉज मामा ने कुछ कहा, मैंने ऐसे यू नो आई जस्ट पुश्ड माई बुक लाइक दिस एंड आई वेंट. सो ये है सटल वेरिएशन ऑफ शोइंग एंगर. यू नो जरूर नहीं है टेबल ही पुश करेगा. डोंट स्टिक टू दैट टेबल. कुछ भी मतलब सटल तरीके से एंगर शो करेगा. सामान थोड़ा सा फेंक देगा, यू नो, बट ओवरली चिल्ला के, बहुत हल्ला करके, बिकॉज he is a reputed person. He will not behave the way others behave, you know. ऐसा कभी नहीं करेगा. So yeah. So this is in short staphysagria, and I've shared 4 cases so that you get an idea about staphysagria. So I hope you all enjoyed it. This is not all what staphysagria is. Staphysagria is much more than this is. I can take 5 lives on staphysagria. But what we are trying to do is we are trying to motivate you to go home and read. We are trying that you should understand a little bit of each remedy and how you pick them in clinic, because कितनी भी theory पता हो, you have to treat the patient. You don't have to write the exams now. So आपको वो clinic में कैसे दिखेगा ये समझ में आना बहुत बहुत ज़रूरी है. Clinic में वो indignation कैसे pick होगा, या mortification कैसे pick होगा, या वो insult hypochondriasis या paralysis anger से अगर आप pick कर पाएं staphysagria, then it is all worth it. Yeah, so I'm really disappointed that why these comments I'm not able to see. There are 110 people and I am not able to see the comments. So I'm really disappointed what is wrong with this Facebook Live. And yes, we'll discuss more of staphysagria. And I have one last announcement to be made. The first webinar that I conducted was 50 important rubrics of pediatric practice. It is just an introduction to pediatric practice. कि बच्चा क्लिनिक में आए तो आप वो चिल्ला रहा है, रो रहा है, शर्मा रहा है, मम्मी के पीछे छुप रहा है, हाथ मुंह पे कर रहा है, what the child is reacting, how to interpret it and how to understand that kind of children. या जिद करके जमीन पे लेट गया है, तो छोटी छोटी ऑब्जर्वेशंस एंड उनसे उनके इंटरप्रिटेशंस, बिकॉज आई स्ट्रांगली बिलीव योर आई सी व्हाट योर माइंड नोज. सो इफ यू नो समथिंग यू विल बी एबल टू पिक अप. इफ यू डोंट नो देन आपको लगेगा अरे बच्चे ने तो कुछ बताया ही नहीं, मम्मी तो कुछ बता ही नहीं रही हैं. सो दैट सेमिनार आई कंडक्टेड 3 times and this is the last and the final time I'm conducting. We don't sell our recorded videos, so please don't tell me that आपने रिकॉर्ड किया है, आप हमें we'll pay and please give that. Please, we don't do it. The major reason being क्योंकि pediatric cases, it is very difficult to blur and make you understand about pediatric remedies. So we sometimes don't blur it. Sometimes where we can blur, we blur it. So it is that experience of learning at that moment of time. It's not about selling those recorded videos to someone. So we never ever do it, and I will never do it. That is why I sometimes delete those recordings also. So yeah, on this 15th of July, that is next Thursday, I'll be conducting that webinar. Whoever wants to attend, please attend this. All the details are available on my Facebook page. Or you want to contact me, you can call me. You'll get my number on Google. I'll tell you now, 7875626071. So this is my number. You can contact me personally. You can contact me on my clinic number and register it fast. We have already 125-30 registrations already done. There are limited seats available, and whoever wants to attend, please attend now, because I'm not going to conduct it again now. Right? So thank you all. Thank you everyone for coming live, and please ask your questions. Please study staphysagria and don't, कई बार क्या होता है, there is suppose one rubric which I have not used it and which probably you have also not used it. एंड कुछ लोग हम लोग उस रूब्रिक पे अटक जाते हैं कि यार इसका क्या मीनिंग है. अगर मीनिंग समझ में भी आ जाए ना, तो वो बहुत ऑफनली नहीं, इट इज़ नॉट अ वेरी प्रैक्टिकली एप्लीकेबल रूब्रिक. तो आप अपने आप को वो छोटे छोटे रूब्रिक्स में ना अटकाइए. इनफैक्ट जो ब्रॉडर पिक्चर है, जो सिंगल रूब्रिक्स हैं, उनको पढ़ने की आदत. जैसे मैंने जब बेलेडोना लिया तो डिल्यूजन बुल्स चेसिंग करके रूब्रिक था. दो आई एक्सप्लेन दैट रूब्रिक, बट प्रैक्टिकली मैंने उसको बहुत यूज़ नहीं किया है रूब्रिक को. तो राइट, जो प्रैक्टिकली एप्लीकेबल रूब्रिक हैं, जो आपको डे टू डे प्रैक्टिस में मिलेंगे, जिनसे आप अपने, the main idea is you should be able to give result to your patient, whoever is coming to your clinic. That is the main idea, right? No matter how much I teach you or how much theory you know about any remedy, अगर patient को result नहीं है, मतलब and we all fail. I'm not saying that I have failed hundreds and thousands of times. So it's just that we have to, stand up again and find the right remedy. And if we are not able to find, we can take the help from our seniors, we can discuss with our colleagues. That always help. होम्योपैथी एक ऐसी प्रैक्टिस है जो आपको घर में बैठ के एक कोने में क्लिनिक पे बैठ के आप नहीं सीख सकते. ज्वाइन वेरियस ग्रुप्स, बहुत सारे ग्रुप्स हैं, आप उनको ज्वाइन करिए. वहाँ पे सीनियर्स सिखा रहे हैं. जो भी लोग वेबिनार्स कंडक्ट कर रहे हैं, उनके पास ट्रीटेड केसेस हैं, वो अटेंड करिए. डोंट मेक योर सेल्फ फेक्स. डोंट से कि ओके आई विल डू दिस ओनली. be open to learning, learn from various teachers, because you get a different facet of the same remedy. मैंने जैसे स्टैफिस को देखा है, प्रॉब्ली किसी और ने उससे भी और 10 तरीके से देखा होगा, जो आई हैव नॉट बीन एबल टू पिक अप इन माई क्लिनिक. सो वी ऑल, होम्योपैथी इज अ जर्नी. वी कैन लर्न ऑल आवर लाइफ एंड स्टिल बी अ वेरी इमेच्योर, या बहुत ही अभी शुरू किया ऐसा ही लगता है, बिकॉज देयर आर सो मेनी फेसेट्स टू अ रेमेडी. सो ऑलवेज बी अ लर्नर. And one more important thing that I would like to say, which has really given me the biggest pleasure in my life, is there were a lot of female homeopaths who had started the practice after I started saying, or they felt that they can also practice, which is very, very close to my heart, because it is not about homeopathy only. I always felt that we females, हम अपने आप को बहुत कम समझते हैं, और after the child's birth or responsibility of the family, and especially homeopathy, क्योंकि हम बहुत जल्दी नहीं कमाना शुरू करते, तो we keep our career aside and we say कि okay, we'll look after the children and we'll look after the family, क्योंकि 5-10 हज़ार कमा के क्या कर लेंगे, उतना तो हम घर में केयर टेकर को दे देंगे. So please don't think that you are not worthy enough to earn. You can earn lots and lots of money. It's just a little bit of hard work and dedication and perseverance towards your practice. Once you are able to do, it's never looking back. So please start your practice. Start from your homes. Start from a small clinic. Start from a polyclinic. It's never too late to start. So I'll end. I'm very fond of quotes, and so I'll end it up with the quote: तजदे मुसाफिर नींद जग कुछ ना गया है, कल तो तेरा था आज जग अब भी तेरा है. So ये मत सोचो कि टाइम चला गया है, अभी भी this is the right time where you can start your practice. बस एक ही बात याद रखना कि diagnosis is equally important. तो ऐसा नहीं होना चाहिए कि हम किसी पेशेंट को ट्रीट कर रहे हैं और हमें डायग्नोसिस नहीं पता और वो प्रॉब्लम में आ जाए. उतना आपको फेलियर आए कोई प्रॉब्लम नहीं है, बट कोई ऐसा ना बोल पाए कि होम्योपैथिक डॉक्टर्स को डायग्नोसिस नहीं आता. तो इफ यू आर नॉट एबल टू, इफ यू आर नॉट श्योर, जस्ट otherwise be brave, start learning, listen to the lectures and start practicing. Thank you all. It's always been a pleasure to come live, but I'm really very disappointed because I'm not able to see your questions today. Thank you.